Fairhaven Health. Our topic is going to be on male fertility and specifically on antioxidant therapy. And our speaker is Dr. Ashok Agarwal, and he'll be here also for a Q&A. I just want to do a little bit of a hello and brief introduction because there's a lot of people here that aren't part of the IFS. So we're running the 2021 Integrated Fertility Symposium right now. It goes until the end of June 30th, 2021. So for those that are part of the IFS, please remember you have until June 30th, 2021 to complete all those courses that are in your account for CEU. That's up to 36 hours. And remember, we have the forums and we have that chat function so we can continue to connect with each other. This year for IFS 2021, what we did for exhibitor sponsors, since it's all online, is we asked our sponsors to, if they were going to be part of the IFS, they had to actually contribute by bringing us educational content. So it wasn't just letting us know about your products or services. We actually asked them to educate us. And several have stepped up, and one of them is being Fairhaven Health. And that's what we're going to talk about today on this lecture. And I just want to share a few things on the website and take you to the IFS website. And so this is a sponsored lecture, meaning Fairhaven, to be part of the IFS, had to find speakers or in-house. In this case, they went out of house to educate us. And we're really, really appreciative because Fairhaven Health invited our good old Dr. Ashok Agarwal, and he is very well published on treating male factor fertility. He has got a lot of research. You're going to see a lot of it today on antioxidant therapy. And so they really, we're really just proud to have them as part of our sponsors, and that they went and found somebody that could really deliver great content that is of value to us, the practitioner. What's also great, and it was obviously easy for them to choose to bring Dr. Agarwal to this conference, is the product that he's going to talk about is the product FH Pro. So they did research, so good research, and they needed a product, and it was Fairhaven Health that gave their product to be studied that showed that it was very beneficial. So when you read stuff about 102% increase in sperm count, etc., this is going to be some of the research you hear, and it's on their product called FHA Pro. So if you want to rewatch this lecture, if you want handouts for this lecture, because the handouts are excellent, you contact Fairhaven Health for this information. And if you go to the IFS website, the ifs.healthyseminars.com website, and you go to sponsors, and you scroll down and click to Fairhaven Health, this is the page. And this is where the recording for this lecture will sit. And this is also where you can request handouts. So I think I have that right here. Click here to request handouts and product information. So if you want the slides, go to the website and click on this link, and you can request handouts, or go directly to Fairhaven Health for those handouts. Also, for the IFS, we have forums, and this is only available to those part of the IFS. But I want you to know that, actually, I'll go right here on the forums, we have special offers. And Fairhaven has created special offers. So you go to the special offers, you scroll down, and I just wanted to let you know that, again, Fairhaven is also offered for those that are part of the IFS. You can ask for samples, and they'll send you some of the samples of the products that are discussed in this lecture and what they have available in their store, basically. Also on the Fairhaven Health sponsor page, if you scroll down, we mentioned there's Dr. Agarwal's talk on male fertility that we're about to listen to, and then he'll do a Q&A. Last year, IFS 2020 was canceled, but they went ahead and created a lecture where Mark Sklar, he's a licensed acupuncturist and the president of the American Board of Oriental Reproductive Medicine. He gave a talk on diet and supplements for enhancing fertility for couples over 35. And that lecture is also available on the sponsor page. And you can also ask for handouts for that lecture too by contacting Fairhaven Health. Now, remember, for today's lecture, there are no CEUs. This lecture is a sponsored lecture just for the love of learning. And the recording is available on the IFS sponsor page section. Please remember that this is for educational purposes only. This is not healthy seminar saying that this is medical advice, so it shouldn't be received as medical advice. If you are in need of health care, please seek out a medical or a qualified medical provider. So our talk today is on, and we can bring up the video for this. Our talk today is on new antioxidants in male fertility, efficacy and novel molecular changes, and is presented by Dr. Ashok Agarwal from the Cleveland Clinic. During this live replay for all of us here in the Zoom room and on the Facebook pages, if you're watching this on social media, during the live right now, you can post your questions and we will moderate those for our good doctor during the Q&A part. Obviously, if you're watching this on social media after the fact, we won't have the doctor to moderate those questions. So for those that are at least in the Zoom room, please do post your questions and we will be very happy to moderate those questions. All right, let's get this recording started, please.
Good morning, everyone, or good afternoon. My name is Dr. Ashok Agarwal, and I am at Cleveland Clinic, and I will be sharing with you a talk today on antioxidants and their effects on male infertility, some new findings of their efficacy, and changes at the molecular level which have been studied by us here in Cleveland Clinic. So let's begin. And the objective here is to discuss the incidence of male infertility on a global level. What are the main causes which is driving this problem of male infertility like an explosion? What is idiopathic male infertility? Define male oxidative stress infertility, a new descriptor that we have coined, and discuss all about antioxidants specifically for male infertility, and then leave you with some take-home messages. So male factor infertility is responsible for about half of all infertility cases around the world. This is a study that we conducted and published in 2015, which mapped out the incidence of male infertility on a global level. And what we can say that the problem of infertility is not specific to one particular country or specific to one particular continent or region. It is a worldwide problem, and it is something that is growing. Approximately about 200 million couples are infertile around the world. About half of these have problems with the men. And 1 in 7 couple is trying to get pregnant and cannot do so after 1 year. Global scenario, there are 15% of couples are infertile, and the incidence of male infertility is something which is as much as 50% of all causes. So this is a worldwide problem affecting over 200 million couples around the globe. The key causes which are driving this explosion of male infertility are because of the changes in the society where men and women are waiting until the ages of 35, 40, 45 to really have their own biological children. They may be living together, but they are not really trying to have a child until they have fulfilled many other obligations that they have set out for themselves. And there is a tremendous concomitant decline in semen quality over the last 40 years in normal, healthy men. And this is seen in many parts of the world, in many regions, in many countries. And it is as much as 40 to 50, 60% decline over the last 60 years that we have mapped. And it is not only in the sperm concentration or sperm motility, but it is also in sperm morphology. So there is an overall decline, and there is an explosion in the number of patients or men and women who are affected by sexually transmitted diseases in their reproductive young age with gonorrhea, chlamydia, ureaplasma, and there are environmental causes which is really causing tremendous amount of havoc. Phthalates, bisphenol, pesticide, all of these things are really causing tremendous amount of damage to our health as well as our reproductive system as well. And occupational exposure, especially from industrial pollutants and from cars, from trucks, as well as from airplanes, all of these things are driving and making our air unhealthy, affecting our health, our lungs, as well as our reproductive system. Lifestyle factor, the sedentary lifestyle, which is really because of the changes in our entertainment and our lifestyle. People are not walking, people are not talking, they are just confined, interested in the social media, watching the phone, and essentially confined to their home and sofa, looking at the television. There is an explosion of obesity. The obesity is number one disease. The cell phone use has been shown by us and many others to generate electromagnetic radiation, which really causes all kinds of health effect, and also affects the fertility by increasing the oxidative stress, causing damage to the DNA of the cells, sperm cells, and making them less fertile. Stress of all kinds, psychological stress, and stress which is because of not only because of the pandemic, but even before. There is a humongous amount of psychological stress among the people who are affected with the condition of infertility. There is increased use of alcohol, smoking, unhealthy diet, diabetes, explosion of diabetes among the young people and middle age, and erectile dysfunction. All of these conditions are really the driver for increase in male infertility. Now let's look at the lifestyle causes which decrease the semen quality. As I said, the cell phone use has been linked to decline in all the semen characteristics, whether it is vitality, motility, morphology, or increase in oxidative stress. Smoking declines, changes everything in the semen: volume, motility, concentration, testosterone level goes up. So this is a disaster. Look at the obesity. We have there is so much changes that are happening, negative changes in the semen because of the increase in the weight, obesity, severely obese, and morbid obese. These are really unhealthy and cause tremendous amount of changes in the fertility. Sedentary lifestyle decreases the concentration, motility, volume. All of these things have been documented by studies conducted by many authors. So many of these conditions, actually endocrine conditions, ejaculatory dysfunction, infection, many of these can be treated medically by various kinds of drugs that are available. And some of them can be treated, corrected very well by surgical correction, such as varicocele, vasectomy, testicular torsion, etc. And environmental and other reversible causes can also be treated. But this requires a consultation with a specialist who deals with the problems of male infertility. So let's look at the term idiopathic male infertility. I mean, this is something that most people don't know. Idios itself means we don't know. It's a Greek term which relates to any disease or condition which arises spontaneously, for which we don't have a cause. We don't know what is the reason. So this is really the story of male factor, where half of the patients, we really don't have a clearly defined cause. They are called idiopathic. These patients really have the most important characteristics of these patients. They have altered semen or poor semen characteristic without any identifiable clinical cause. They with or without abnormal oxidative stress. So they may have normal or abnormal oxidative stress or sperm DNA fragmentation. And the most important, there is no female factor in these patients. So the problem lies in the male. This is either hidden or it is clear, and that we don't know. So the treatment for these patients with idiopathic male infertility, the standard treatment, which is not really well established or recommended by professional societies, such as empirical medical therapy, hormonal treatment, which can be helpful, HCG, androgens, aromatase inhibitors, and to improve the semen quality, or certainly most important, healthy lifestyle, diet, exercise, stop smoking, combination of empirical medical treatment and antioxidant, and assisted reproduction. So antioxidant treatment is really very helpful for these patients with idiopathic male infertility. The global incidence of male infertility, as I described in the beginning, is almost 200 million couples are infertile. If you look at the male factor, it is about half of all causes, is almost 100 million. And if you look on the right side of this, you will see idiopathic is about 50% or about 46 million couples where male factor is present. And then in 80% of these patients, what we have is an increased oxidative stress and abnormal semen quality. So we characterize these patients as having MOSI. There are almost 40 million couples with male partner which are having this clinical condition called MOSI. So let's learn what is the concept of MOSI, which we have described and published. So let's talk about oxidative stress, which plays an important role in the etiology of male infertility. If you look at the physiological role on the left side and the pathological role. So in very small quantities, these free radicals are really important for a variety of functions of the sperm which prepare them for fertilization. And then when they are produced in larger quantities or when there is a small amount of antioxidant, that can result in a process of lipid peroxidation, causing damage to the proteins, DNA, and cell death. So in about 30 to 80% of infertile men, there is an increased reactive oxygen species, which is a potentially treatable condition. So we banded together and conducted a large study and wrote this important guideline article called Male Oxidative Stress Infertility, or MOSI, Proposed Terminology and Clinical Practice Guideline for Management of Idiopathic Male Infertility. As I said, idiopathic male infertility is a dreaded condition that nobody knows how to treat. So the physicians don't know, the patients are completely frustrated as to what, and this is a hit and miss. So I think we are the first one who have come out with a clear-cut guideline and a clear-cut condition. And this was written in this paper with 90 authors, specialists from 6 continents and 26 countries. And the concept of MOSI is that male reproductive potential cannot be evaluated completely if we are not examining the patient for seminal oxidative stress. Currently, there is absolutely no consensus on how to measure oxidative stress or diagnostic terminology. We propose the term male oxidative stress infertility, or MOSI. So this is a very first finding. The diagnosis of MOSI can be done by measuring oxidation reduction potential, which is a clinical biomarker for classifying MOSI. It takes into account the levels of both oxidants and reductants into the biological fluids such as semen, and it can be measured by a device called MyOxys, or male infertility oxidative system, which is easy, reproducible, cost-effective. It takes 3-4 minutes, no training required, and this is something that we are doing it on our patient. We have trademarked this test called MOSI-T, and this test is being offered to our patients at Cleveland Clinic for last 4 or 5 years. The diagnosis of MOSI is very clear-cut, where the ORP levels, which are the indicator of oxidative stress, are inversely correlated with sperm concentration, sperm motility, normal morphology, and total motile count. And we have established the cutoff value of ORP as 1.34 millivolt per million sperm by ROC analysis, or receiver operating characteristic curve analysis, above which ORP was considered as abnormal. So here is the cutoff value. These are the abnormal group of patients, about 600, and then 200 normal patients where the ORP levels are distinctly lower. And this red line is where anything above this is considered as significant. And here on the bottom, you will see that these are patients with normal sperm quality, and these are patients with abnormal semen quality. You can see the ORP levels is going through the roof in the patients with abnormal semen quality. So how to screen and treat patients with MOSI? We created this algorithm, a workflow diagram, which involves testing each and every patient who's coming for a basic semen analysis, doing oxidative stress evaluation by ORP, and anything which is more than 1.34 millivolt ORP indicates oxidative stress. There are several lines of investigation based on this patient. If they have inflammation or white blood cell or prostatitis or MAGI, they can be treated with antioxidant and antibiotics and anti-inflammatory and retested for MOSI. Those who don't have any other cofactors or co-condition, they can be characterized as completely pure MOSI and treated with antioxidant for 3 to 6 months and retested for MOSI. Lifestyle conditions such as smoking, obesity can be counseled and then retested. Varicocele can be surgically treated. So clinical guidelines MOSI for MOSI is that MOSI should be suspected in infertile men with abnormal semen characteristics and oxidative stress. These men were previously classified as idiopathic with no underlying endocrine, genetic, or anatomical causes. These men should be offered testing for oxidative stress or ORP by myopsis to potentially diagnose MOSI. So let's talk about antioxidant. We have been hearing about it. So let's see what it is. So this is the study. These slides represent what we call as double-blind randomized controlled trial, documenting the impact of male fertility nutraceuticals on fertility characteristics. So these are the highest quality studies, which are double-blind randomized control. And you can see there is a lot of criticism in the literature by many of the experts that they are not enough. There are very few double-blind randomized controlled trials. So the scientific evidence is very weak to really prescribe or recommend the antioxidant treatment for male infertility. We said that it is completely untrue because there are a number of studies, and I'm going to show you 4 here and more. So this, if you look at the bottom of each, every single study from various countries and various authors in very, very good journals, Fertility, Sterility, these are very, very good journals, and andrology show that there is an improvement in sperm count, sperm motility, reduction in oxidation stress, high pregnancy rate, improved sperm concentration. There are more. This is another 4 more studies. These are all double-blind randomized controlled trials. These are the gold standard. And here again, you will see that every single study here shows improvement, 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 even improvement in pregnancy rate. So this is really the truth of the matter, that there is tremendous amount of good clear-cut studies which demonstrate the improvement in semen quality as well as infertility indicated by pregnancy rate by a number of nutraceuticals or antioxidant supplements, which are, if they are given for 3 to 6 months, can be very helpful. So there are some myths and the reality. If the myths of antioxidant treatment are few antioxidant trials are published, well, I showed you there are plenty of them. There are 33 blinded, randomized controlled, 12 unblinded, and 52 uncontrolled studies. So that is the reality. That myth is multi-center studies based on large sample size are needed. This is a very easy criticism that anybody and everybody likes to throw. But the fact is, cost of multi-center studies based on large sample size is unaffordable for investigators for a very low cost of antioxidants that are available. Next, placebo-controlled studies should be performed. Again, this is unethical because denying the treatment to patient in placebo arm is unethical. The other criticism of antioxidant is length of antioxidant treatment is usually insufficient. However, majority of the study, almost 84% published report a length of treatment of more than 3 months. So this is very clear. Other criticism, more rigorous patient selection is needed. Well, many studies published on antioxidant treatment in patients with varicocele, abnormal semen quality, urogenital inflammation, idiopathic male infertility, and unexplained male infertility. So these are the groups which really can benefit by antioxidant supplement, and that need more studies investigating the effects of combination of antioxidants. Well, there are more than 25 such studies, and registered antioxidant products are almost 24 studies. So there is no shortage of science. Other criticism by so-called experts is that the pregnancy and live birth outcome are needed to evaluate the efficacy. Well, the reality is that there is some data on pregnancy, but the bottom line is several factors can influence the outcome of pregnancy and live birth. Besides the semen quality, it's a multifactorial condition to have a pregnancy or a normal child live birth. So it is not to be considered as the role of only spermatozoa. If we can demonstrate improvement in semen characteristics, semen quality, that in itself should ensure improvement in fertility and pregnancy. Molecular basis of antioxidant is not known. That is again untrue, because our own studies, which I am going to share with you very soon, have shed light on the molecular mechanism following antioxidant therapy. So let's talk about antioxidants. This is a clinical guideline based on systematic review analysis of evidence that we published, and the goal here was to update evidence-based report on antioxidant treatment for male infertility based on systematic and critical analysis of current evidence in literature. We looked through over 2,000 studies in the literature, and we hand-checked these studies, and we, through the process of screening, we were able to finalize studies which had qualitative synthesis. There were 100 such studies that we actually then selected for final review of our study. And here, these studies were then evaluated very rigorously using a variety of evaluation tools, such as the Cambridge Quality Checklist, the Cochrane-based risk of bias for randomized controlled trials, the Consort Guideline, the Jadard score. So these are 4 different tools that we employed, which is really something that most people have never done. So here it provides the criteria for classification of studies into low and high quality categories, as you can see by variety of tools. And this is the meat of it. There is this figure really captures this study that we published. It documents the beneficial effects of antioxidant on semen and sperm function. As you can see that the yellow bar is the one which shows the semen parameter, and the orange bar is the sperm function. So clearly almost 86 to 90 or 100% of the studies demonstrated a significant improvement in semen quality as well as in sperm function amongst infertile men. In patients with abnormal semen quality, again, we saw very high rate of studies which showed significant improvement in semen quality and sperm function. 100% of the studies with idiopathic male infertility, and a very high number with unexplained male infertility. Again, this proves the point that the literature is rich in studies, and it overwhelmingly demonstrates that there is a significant improvement in semen quality, that antioxidant treatment is really beneficial. And this has been rigorously checked by looking into the evidence, the data of each and every study that have been published in the worldwide literature. So what are the indications for treatment with antioxidant? And these are a variety of indications. Repeated IUI, IVF failure, when the patients have these conditions, they should take antioxidant. They should be prescribed. Patients with varicocele can also, even if they are undergoing varicocelectomy, they can take antioxidant. That helps as in terms of improving the quality of these their semen samples. Older men, history of genital tract infection, smoking history, idiopathic infertility, recurrent spontaneous abortion. All of these candidates are where antioxidants should be indicated. Antioxidant compounds that are used for treatment are listed here, and you can see vitamin E, vitamin C, L-carnitine, N-acetylcarnitine, coenzyme Q10, zinc, selenium, folic acid, and lycopene are some of the most important and studied compounds and their dosage which have been reported. So this is the main ingredients that have shown beneficial effect on sperm quality, whether it is on sperm concentration such as vitamin C or V or E or L-arginine on the vitality or astaxanthin on capacitation or folic acid on DNA damage or zinc and selenium on sperm motility and morphology, which has been shown in a number of independent studies looking at different ingredients and their effects on semen quality. So based on these, we conducted a clinical trial recently and published it in a very high impact journal called Antioxidant, where we look at the efficacy of antioxidant supplementation on conventional and advanced sperm function test in patients with idiopathic male infertility. This is a new study that we conducted. And this was a prospective clinical trial consisting of 150 infertile men. Majority of them, 90%, were idiopathic, and about 10%, I will say, had unexplained male infertility. These patients were given antioxidant for 3 tablets twice daily, or total of 6 tablets for 3 months. And we looked at the semen quality, count, motility, progressive motility, vitality, morphology, oxidation reduction potential, and sperm DNA fragmentation following WHO 5th edition guidelines. And what did we find? Well, I mean, this is the composition of the antioxidant supplement. We use FH Pro for men, made by Fairhaven Health. And these are the ingredients of this particular formulation, which is a very cancer, or if they were taking any kind of over-the-counter treatment and vitamin supplementation. And we also remove patient if they have any kind of infection. So the study population was about 150, 90% of these were idiopathic, or within this idiopathic was the majority of patients, and the rest were unexplained infertility. In all of these idiopathic infertility patients, they were positive for ORP. Almost 91% of them have what we call as ORP. So this is a very high rate of oxidative stress. So they were defined as having male oxidative stress infertility. And these are the results. This is beautiful results. You can see the orange or the yellow bar and the green bar. The yellow bar is the before treatment, and the green is after the treatment in terms of all the semen characteristics, whether it is concentration, motility, or progressive motility. You can see there is a humongous increase of 55% in terms of the sperm concentration, almost 16% increase in total motility, almost 143% increase in progressive motility, which is one of the most important quality of spermatozoa, which are really progressively motile and fast moving. And these are the sperm which really are able to fertilize the egg. So these results are fantastic. And then, but that is not enough. There we have improvement in normal morphology, as you can see, almost 86% before and after. So this is a humongous increase. Also, there is a significant decrease in harmful oxidation reduction potential. As you can see, almost 40% decline from before treatment. So this really stabilizes and normalizes the oxidative stress, and also it changes and decreases the amount of DNA damage before and after treatment, which is very good news. So now if we look at the real attributes of a good antioxidant which can reduce high sperm DNA fragmentation, FH Pro is one of them. And it has vitamin C, vitamin E, beta carotene, zinc, selenium, folic acid, vitamin E, vitamin C, L-carnitine, and so many other coenzyme Q10. So this is the antioxidant which really can be very helpful in terms of improving not only the semen quality, but also decreasing the damage to the sperm DNA and improving overall health of spermatozoa. So this is, and we have some reproductive outcome as well. And you can see, although it is not very large because we followed only for 6 months after the treatment, still the rate of pregnancy is pretty decent, and you can see about 17 out of 148 were pregnant, and in that almost 10 of them were spontaneous, and few of them are due to assisted reproduction. Same thing goes for unexplained male infertility. So this is a good news. Now, more important news is people want to know, yes, I can see there is an improvement in sperm count, sperm motility, or morphology, which are very, very good news. But what is really happening to the spermatozoa? How are these antioxidants affecting and impacting on these changes that we see in increased sperm count or increased motility? What is the mechanism? How is that happening when we are taking the antioxidant? How is that really changing the fertility indices? So this was a reason we conducted this study in Cleveland Clinic recently and published it into a high impact journal, where we wanted to look at the antioxidant supplementation on sperm proteome, on sperm proteins, which are the building block of the cells in, again, idiopathic infertile men. So our study design included these men, which is a prospective study where we collected the samples 2 times from these patients, and they had the antioxidant for 6 months. And after treatment, 2 semen samples were collected again from these patients. So if you look at the study criteria, this is the study criteria: no use of antioxidant before, no varicocele, no other type of treatment. Patient tested as a spermic were removed, and those who have obstruction were removed. So this is a simple flow diagram of the work that was conducted as part of this particular molecular analysis to study the proteins. So the patients were given the treatment for 6 months, and then we looked at the semen samples. We actually fractionated and separated the proteins from these sperm samples, and then sent it to the proteomics core lab, where they did the mass spectroscopy to really characterize the type of proteins that are there, which are present in before the antioxidants were supplemented or given, and after the antioxidants treatment was completed, to see if we can characterize the type of antioxidant, type of proteins that are present in these 2 populations of semen samples, and if there are any particular changes that we can pick up. So here we have the expression profile of sperm proteins. Patients who were idiopathic, here before antioxidant treatment, we found about 2,000 proteins, and then after antioxidant, again, over 2,053. The total number of proteins were about 2,137, and those which were differentially expressed, which were present only in the pre-antioxidant or only in the post-antioxidant, were about 379 or 380. And then on the pie diagram, you can see that there are specific proteins that are present, which are only present in these conditions, such as post-treatment. There are 26 such proteins, and some of them are overexpressed and some are underexpressed. So what does that mean? And here the results really try to summarize this for you. So the yellow bar is the level of the protein, a specific protein before the treatment of antioxidant. Green bar shows after. These are specific proteins which were characterized by Western blot, and then they were analyzed. What we see here is there are 3 particular proteins, such as CCT3, which is responsible for sperm binding, NDUFS1, which is responsible for oxidative phosphorylation or oxidative stress, controlling the oxidative stress, and picaria, one, which is responsible for sperm motility. These are the proteins which are dictating the functions which really make the sperm bind to the zona pellucida of the egg, or allow the sperm to move or have the motility, or really responsible for free radical scavenging, so that it will keep the balance of oxidant and antioxidant. And you can see there is a tremendous increase in all of these three important proteins, uh, whether it is CCT3, whether it is NDOFS1, which is responsible for oxidative phosphorylation, or picaria1, which is responsible for sperm motility. This is fantastic research. They have never, ever been shown in any place in the world. This is the first time alone that we have shown for any antioxidants. This is provides the solid basis that antioxidant supplementation has beneficial effects on sperm function protein, which are associated with fertility at the molecular level. So our message is that this novel proteomic study really helps to decipher the role of antioxidant in activating the antioxidant defense mechanism at a subcellular level, along with its beneficial effects on sperm proteins essential for the fertilization process. Our proteomic findings suggest that sperm proteins such as NDOFS, CCT, picaria, and SPA17 can serve as potential biomarker to monitor the effect of antioxidant therapy in men with idiopathic infertility, and that recent proteomic findings really offer a better understanding of the molecular pathway involved with antioxidant supplementation. Our findings will serve to guide physicians in determining better treatment options for the management of male infertility, as oral antioxidants are an easy and cost-effective alternative for couples who really want to avoid very costly and inefficient assisted reproductive treatment. Thank you very much.
All right. Again, I want to thank Dr. Agarwal for this lecture. We're going to have the good doctor on for your questions in a moment. I just want to remind you and thank you for Fairhaven Health for organizing this lecture. Dr. Agarwal is dependent of Fairhaven Health. He used their product in the research. So during the Q&A, if you have questions about the research and male fertility, Dr. Agarwal will take those questions. And then we have, hopefully, I see Suzanne's here from Fairhaven. If there's really specific questions about the product or getting that product as a practitioner, she's going to be able to answer that question.
Lauren, can you turn your camera on?
Oh, sorry. Yes, my camera's off. Also, if you want the handouts for this lecture, when you go to the IFS website to the sponsor section, you can click here to request handouts. So if you want handouts to this lecture, you can go to the Fairhaven sponsor page on the Integrated Fertility Symposium website, or you just contact them directly if you can't find this website. Also, for practitioners only, if you want samples of any of their products, including the Fertile Pro, this product here that they're talking about, the FH Pro for men, they're willing to send out samples to practitioners. If for whatever reason you're the public watching this, you're a consumer, then talk to your naturopathic doctor, your licensed acupuncturist, your physician, and ask them to carry this product or get that sample for you, okay? The recording, if you want to watch this again, is on the sponsor page for Fairhaven Health, so you can watch this lecture again. And also the lecture that Mark Sklar did last year for IFS 2020, talking about diet and supplements for enhanced fertility for couples over 35 is also on this page. And yes, you can also contact them for the handouts and get samples for any of their products. So just wanted to be clear on that. And then reminding you, for those that are part of the Integrated Fertility Symposium, we have our forums. So between now and June 30th, now we're going into our second month almost, you can have discussions here about the lectures and case studies, so we can continue this discussion after here on the forums. And then under special offers, please check out the special offers if you're part of the IFS. all the sponsors have put out special deals. And again, Fairhaven Health has special deals on their products, and they're offering samples, and that's all under the forums. All right, let's go to our Q&A. So let me just pull that section up. And do we have our good doctor here in the room with us? I just want to make sure Dr. Agarwal's got his camera on.
Yeah, I'm there.
All right, nice to see you again. It was a couple weeks ago we had you on a panel for male fertility, and that was very informative. So we are looking forward to today as well. First question is, in the description of this lecture, they talked about how the antioxidant therapy improved motility, sperm count, reduced DNA fragmentation. Can you remind us, was there any impact on morphology with your research? I think you mentioned it, but could you repeat that for us, please?
Well, first of all, thank you very much, Lauren and Sandro, for inviting me, and for Fairhaven to sponsor this program. I think this is a fantastic program. I was very pleased with the program that you did 2 weeks ago, and invited me to the Q&A session. So that was fantastic. Yeah, I think if you saw our first clinical trial, where we conducted a study, a prospective study with our colleagues in Qatar, using 150 infertile men. These are idiopathic infertile men, where they were all having diagnosed with oxidative stress by testing them beforehand. They all demonstrated improvement in all the important parameter: count, motility, morphology, and reduction in oxidative stress, and decrease in the level of sperm DNA fragmentation. The morphology was significantly improved. I don't know specifically exactly, maybe 50%, but there was a tremendous increase, improvement in the sperm morphology by strict criteria. So these results are just not only good, but they are, I think, excellent in all different measures that you can look at. So we looked at everything that we can using the WHO 5th edition criteria for examining the semen sample, but also went over and above to look at the functional parameters, which are for oxidative stress and sperm DNA fragmentation. So pretty much everything across the board showed significant improvement. Either the oxidative stress decreased significantly, making the sperm healthier, sperm DNA fragmentation reduced significantly, or there was a significant improvement, all the basic semen parameters that can be measured. And they were given the treatment for 6 months.
Thank you. And so on that 6-month idea, we had the panel with Dr. Paul Turk and you and Dr. Olivia Poirier a couple weeks ago. And Dr. Turk had mentioned before that, yes, the sperm maturation, 72 to 90 days, but some of these epigenetic changes that we notice, we don't notice until 6 months later. Even though it should take 90 days, we don't see it for 6 months. Is that what you have been noticing in your research and the research that you review, that it is more of a 6-month process to see the change versus just going during that 72 to 90-day period?
This is a great question. And actually, we just conducted a study and we submitted to the ASRM to look at what is the literature saying about the length of treatment. And if there are longitudinal study where the antioxidant have been given for 3, 6, 9, and 12 months. And because there is a lot of controversy and also problems in the literature where some of the investigators are only giving it for 2 months or 6 weeks and expecting some outstanding results. The process of spermatogenesis, as Dr. Turek explained, will take over 3 months. I mean, not only the process of spermatogenesis, but for the transport of the sperm. So that in itself could take almost 74 to 90 days. So by having a second cycle of spermatogenesis or the length of treatment to cover 2 cycles, what it is that the process of spermatogenesis is a continuous process. So you may not capture all the sperm, which may be affected by the dose that you're giving. But if you give the treatment for at least 2 cycles of spermatogenesis, it is possible that those population of sperm which are not affected earlier and were used for or were the time when the couple tried or when they were used for ART may not have gained the maximum advantage due to the antioxidant that were given. Hopefully, by having it given for 2 cycles up to 6 months, you would be able to rule out this particular problem that can happen just by giving for 3 months. So the literature is kind of split up. 50% of studies we found in our article that we submitted to for the meeting, ASRM meeting and abstract. 50% are giving it for 3 months, and the rest are giving for about 6 months.
Thank you. And then when you're talking about the oxidative stress test, the diagnosis of MOSI, and I think it's Myoxis is the system that you guys have patented. Is it available to other clinics, or is it only in the Cleveland Clinic? So this oxidative stress test, also part 2 of the question was, is it a blood test or a semen test? And again, if it's a semen test, is it accessible to practitioners nationwide?
Yeah, the test is not patented by us. What we have patented is not patented, even trade name is the name of the test. Okay. But the test is developed, our test is marketed by a company. It's an American company. It just sold it to another company, so I'll have to look up the name of the company. Earlier it was by Ethan knows the name of the company and the owners. So they actually just sold it. So it is available to anybody and everybody in the United States, but in many parts of the world. Secondly, the test is that we had, what our role was to really conduct this test in semen sample and standardize this technology for measuring the oxidative stress in semen. Before that, this technology was there, but was never used for anything to do with reproductive fluids. So we were the first one who played around with this, and we were able to standardize and develop the protocol, and which has been used not only in our lab, but in other places all around the world.
Thank you for that. For the hidden male, this idiopathic factor where we can't even detect it, because what I think we heard is there's a lot of male factor, but we can't even detect it under the standard of testing that's leading to infertility, unexplained infertility, or miscarriages. So do you recommend prophylactically treatment of antioxidant therapy? Would you, based on your research, for couples who are now trying to conceive, if they're having challenges, to just prophylactically treat with antioxidant therapy for the guy, even though semen analysis is normal?
I personally feel that there is a lot of things that are going on, and one needs to really understand what exactly is driving the problem. So the concept of this idiopathic is multifactorial, and by having the couple, the man examined by a really qualified male specialist, male infertility specialist. Generally, these are urologists who have completed a special training after completing their residency in urology, and which is another 1 or 2 years in this country. So these men should be examined when they are having a problem, and this is a standard protocol, although it is not followed in many cases. So what happens, at least at Cleveland Clinic, if the couple is having a problem, they will make an appointment with the gynecologist as well as with the urologist who specializes in male infertility. And if when the man is being examined, and if there are no clear-cut cause, as I explained, there are no endocrine cause, there is no genetic cause, there is no anatomical causes, and the patient has abnormal semen quality and has no female factor, or even if in unexplained male infertility, they have normal semen characteristic, but no female factor. Under many of these circumstances, we have to look at what is the lifestyle issues, what kinds of factors that they are exposed to, what kind of food they are eating, what are they exposed to. So a number of things that can come out by just doing a proper reproductive history and asking both men and women about many of these standard questions. And by listening to the patient, asking them very specific questions, some of the hidden problems can be discovered. If a patient has infection, that can be discovered. If a patient is a smoker, patient is using some kind of recreational compounds or drugs, that can be discovered. So there are and exposure to various types of pollutants or pesticide, unhealthy lifestyles. So there are many things which can be mitigated by recommending or advising the patient to perhaps make some changes in their lifestyle. And antioxidant will be helpful if there is a need for having the antioxidant, because if antioxidants are given, they may act like a placebo. They may not always be helpful. They may not be harmful either, but they may not always be helpful. But if they are given in a correct setting, as I described, that the patients who have demonstrated oxidative stress, that 90% of those patients will benefit. But if you are giving it at random, yeah, this is hit and miss. So some patient may benefit, some may really not benefit, but you will really never be able to tell what was the reason for their improvement, if there was an improvement.
Right, because I'm thinking there's the research part and there's the clinical part. And so as you're saying, if they don't have the oxidative stress issues, then you're not really going to probably make a difference. But if you're able to test for oxidative stress, which that test that you guys use is not standard of care yet, then you could really pinpoint who you're going to use. And I think clinically where the question comes from is the alternative often for these men is ICSI IVF, which is a much more invasive procedure and expensive. And if it's the male factor and the woman tests normal, it's the woman that has to go through the procedure. And I think in your last panel that you were on, this was one of the reasons why this is a good prophylactic treatment, antioxidant therapy, because it's pretty non-invasive and comparative cost minimal compared to needing an ICSI that could potentially be preventable.
Yeah, I mean, I agree. I mean, I think it will not be something that will cause any harm if it is not given in too much doses, which is also an issue that some people think that if it is good, you can take 10 bottles of it every day, and that will make it even super good. But it doesn't work that way. I think it can also cause harm. But addition to the antioxidant, there should be other issues that should be addressed, the lifestyle issues, certainly many of the other issues that we discussed in their day-to-day life is stress, which is a big factor. So
Dr. Agarwal, because you're a medical doctor, your audience is naturopathic physicians and acupuncturists. The lifestyle, don't smoke, eat well, exercise, that is that is their training. So that is something that is like, you know, it's just, of course you do that. You brush your teeth when you wake up. That's the first thing that all these people talk to their patients about. But I know it's something that it's obvious, but I know it's not often done in the medical practices. But yeah, and also a point that you made, and we'll get through some of these other questions, is that they need a really good workup from an expert like yourself, because it's been said many times that when you have male factor fertility, think of it as the canary in the mine, that there are other health issues usually that are associated with the sperm quality issues or the male factor fertility. Don't think it's just the branch, the symptom that you have to address, that you need to look elsewhere. And that's your window to make sure you get this person referred to an expert that can give them a thorough workup, because there could be other health factors that are contributing to this male factor issue.
That's correct. Actually, there have been several studies that have come out in the last 4 5-6 years, where they have looked at a variety of health conditions which are the mortality rate, or a variety of other serious health conditions which are really high in patients who have male infertility. So if the problem of male infertility remains undetected, then certainly many of these patients, or some of these patients, can actually later on can have a variety of serious conditions. By going to the physician, they can perhaps have a chance to get an early warning of some of the problems that may be like a silent diseases which are there in their bodies, in their conditions which are not fully expressed at a younger age.
Then the testing, it's becoming more common to see the sperm DNA fragmentation test being offered. What's your opinion when you compare the DNA fragmentation test versus the semen oxidative stress? Which one, when you're looking for clinically being able to address the malefactor, which one would you prefer, or do you think both are necessary?
Well, the sperm DNA fragmentation is a consequence, or one of the consequences of oxidative stress. So in the scientific literature, we know a lot about oxidative stress for a long time, but the biggest problem is that it has not been converted into a easy, simple laboratory test. So even though the knowledge about oxidative stress is much more older or earlier than the knowledge about sperm DNA fragmentation was developed, there have not been easy, simple techniques for measuring oxidative stress in a laboratory diagnostic setting. But sperm DNA fragmentation, on the other hand, has become something which could be measured by a variety of tests and methods around the world. So there is not one technique which can allow us to measure sperm DNA fragmentation, but there are dozens of techniques. And I was just talking in another conference yesterday. It is very easy for most of the people to misunderstand that sperm DNA damage is just a very simple or homogeneous kind of condition. It is a very complex, very heterogeneous type of damage or changes in the sperm chromatin. And there are dozens of different varieties of changes that can be expressed. The biggest one are the single or double strand breaks. And those are the ones which have the most data related to reproductive outcomes, such as IVF, Efficacy, or IUI, or pregnancy. So the data is very, very rich in terms of relationship between sperm DNA fragmentation. Sperm DNA fragmentation is one kind of sperm DNA damage. So it is one which we actually measure by a variety of tests, whether it is sperm chromatin structure assay or tunnel test or SCD. So there are a variety of tests. So for us in Cleveland Clinic, we have been using both of these tests because both of these tests tell a different story. Now, for most places or clinic, they don't have access to both, and it is not always necessary. They can use just one test. Either they can measure the ORP levels, or they can measure the sperm DNA fragmentation by any of the techniques that they have standardized in their own settings. So this is my suggestion.
Thank you. There was some clarification wanting to be asked about the oxidative stress test that's been used on men. Was it used on men that had unexplained infertility? So there's infertility, but the semen analysis was normal based on the parameters. And if so, do you see an elevation in oxidative stress in the population that have unexplained infertility where the semen analysis was normal?
In this particular study that we did, the group of men who had unexplained infertility was rather small. In general, the incidence of unexplained infertility is very small compared to idiopathic, first of all. And second, there are a tremendous number of patients we test, and we find that patients who have normal semen quality generally do not have elevated ORP levels. So that is not a common finding.
Thank you. Did you notice if there was any, did you notice if the occurrence of spontaneous abortions, if that changed, was it decreased compared to like a control group or the normal statistical average?
In the study that we conducted, Lauren, we don't have that data. Okay. This was a study where the follow-up was fairly small. It is very difficult to have follow-up in many of these type of studies. Once the patient has received their treatments, they generally don't keep in touch either here or in any other part of the world. So having a follow-up is generally very, very difficult for most of the reproductive type of studies. So we only have a small set of reproductive data or reproductive outcome for only 6 months, but to have a data on every single patient is generally very difficult in most of the studies.
I understand. If money was infinite and so was time, we'd have these answers. And if everybody was a mouse, then we'd have all the answers. So when it comes to humans, it's a little different. Dr. Agarwal, I want to thank you very much. And I also want to thank Fairhaven Health for organizing this. If Ethan or Suzanne has any comments or any things that you want to just let people know, I'll keep reminding you guys. And so Ethan, if you have anything, I'll let you have your camera on in a sec, but and Dr. Agarwal, if there's any like last words as well, I just want to share one more time. If you want to see this video again, if you go to the sponsor page on the Integrated Fertility Symposium website, or you can go to healthyseminars.com and click the IFS2021 link on the menu, it'll take you here. Go to the sponsor page. Here's where you can request the handouts for this lecture. This is also where, if you are a practitioner, you can ask for samples. They carry many things. We like their sperm-friendly lubrication they have available. They have LH strips and HCG, the pregnancy strips that we offer to our patients. So they got many products. So if you're looking for samples or the handouts to this lecture or the lecture that Mark Sklar did last year, please contact them. Again, this is the product that the research that was discussed was done on. And Ethan or Suzanne, do you guys have any last words you'd like to say? And then Dr. Agarwal, if you want to have any last words, that would be great as well.
Let me have Ethan or Susan say, and then I'll share few things before I leave.
Thanks everyone for coming. Thank you, Dr. Agarwal. As always, it's a pleasure to hear what you have to say. Always so much to learn from you and your research. And yes, I think it's been throughout the chat where you can reach us if you would like to. So certainly if you have any questions, please reach out. I'm happy to provide more information or samples. And thank you, Lauren, for putting this all together.
Yeah, I muted myself. I didn't realize, I thought you guys had muted me. But I also want to reiterate, it would be wonderful to be up in Vancouver because we really enjoy the IFS show every year. But this has actually been a great event and very impressive what you put together. So thank you, Lauren, and your whole team for that. Thank you, Dr. Agarwal, for doing this great presentation. We've enjoyed working with you and working with you on the studies and such. And most importantly, thanks to everyone that attended. It was a great turnout and really appreciate everyone being here. We believe wholeheartedly in our products and the science behind them. And as such, we just love the opportunity to earn your trust and to work with you and hopefully help support your patients and your practice. So if you have any questions, if you want any samples, if you want to stock products in your clinic, we're offering a special right now for all the IFS attendees, 25% off your first order. We're available on FullScript or all the normal online channels that you would expect to find our products. But again, we would love the opportunity to work with you and really appreciate you taking the time to attend the presentation today.
Thank you, Ethan. And Dr. Agarwal.
Yeah, no, thank you very much, first of all, to IFS for inviting me to this wonderful seminar. I heard from Ethan about the great time that he has been having every year in Vancouver. So I look forward perhaps for an opportunity maybe next year. But I wanted to tell or say to everyone that there are a lot of misinformation about the role of antioxidants in scientific literature, specifically on male infertility. And I firmly believe that this is something that has to be changed. And we are working very hard using the science as the only thing that we know to to shed the light that a lot of false information or articles that are coming in which provide one-sided information about the importance of antioxidant or lack of importance of antioxidant in male infertility are only telling one side of the story. And I think the bigger picture is that antioxidants have a role to play. And I think if you look at the studies that we have presented, clearly there is a fairly large segment of patients where the antioxidant, if they are given in a correct way, could be very useful. And obviously, this will displace some of the more invasive treatments that are pushed by reproductive community, such as IVF, which are probably not even necessary in some of these cases, where natural pregnancy can happen easily for these couples. So I think it is incumbent upon every single person who's listening to know the facts, to look at the literature, read things carefully, and not be look at one article and make up your mind and say, well, no, it's totally something that will not work. So there are papers being published in important medical journals, but we find that there is a lot of bias, a lot of agenda that scientists have or whoever is writing. So getting a balanced research, science-based articles which conduct these type of studies requires careful looking at the literature. But I believe, as I showed, the number of studies which are randomized controlled trial, which are the gold standards. So people say, well, they are very small studies. They are only for 50 patients or 200 patients or 300 patients. Well, that's what it is. I mean, if you look at any aspect of infertility, this is the same criticism that you will see. You will not find thousands of patients. I mean, it's just not possible. So you have to look at what is there in the literature and make the best out of it. We cannot just invent something out of thin air. It takes time to build the evidence, but the evidence is there. It may not be perfect, I can say, but it is darn good. And I think we should not hesitate to really embrace it. And I think the practice of pushing the couple and pushing the woman to take the burden of reproductive care and treatment is just, I think, is wrong in my view. I mean, the men should bear the burden of treatment. And I think this is the old mindset that is still being propagated in every single sphere. It's not just a woman taking care of the baby, but even the taking care of the reproductive treatment, I think, is plain wrong. It's not needed in many of these patients, where men can actually be treated and they can have natural pregnancy. So that's my take on it. I know a lot of people may not agree, but this is what I believe in.
Thank you. That is an important message. And I think for the women that go through these treatments, like to hear it from a medical doctor, because often they need that credibility coming from you, who's done research, to inspire the men to seek treatment. Otherwise, they hear that ICSI is the only way. And so it's nice to hear that there's another option and things that they can do. So thank you for that message. Again, if you want the handouts to this lecture, please contact Fairhaven Health. These slides are something I'm sure you're going to want to refer to again. And also the recording is available on the IFS sponsor page for Fairhaven Health, so you can check that out. It's also available on the Integrated Fertility Symposium Facebook page and on the Healthy Seminars Facebook page. So if you have trouble finding it on our website, you can go to our social media page as well. Again, Dr. Agarwal, thank you very much. And I want to thank Suzanne and Ethan from Fairhaven Health for organizing us. Yes, we got to get you to Vancouver, and I'm sure you and I are going to have more interviews. Dr. Agarwal, I've enjoyed the 2 meetings that we've had so far. And thank you guys for joining in for this pop-up lecture, this sponsored lecture. And please continue to go to your IFS website. The forms are there, the chat function's there. Remember, you have until June 30th to finish your CEU PDA lectures. So please make sure you work through those lectures between now and June 30th.
Thank you.